Hello everyone, my name is Tracy Nguyen, and today I'd like to give you an overview about the HIM role in revenue cycle management. First and foremost, I will go over the following objective. The first objective will be introduction to revenue cycle management. Second is different stages in revenue cycle management or RCM. Third is who are the stakeholders. And fourth, I will go in depth regarding the difference between clean claim versus non-clean claims. Lastly, I will also talk about an opportunity for HIM to improve in revenue cycle management. So what is revenue cycle management? According to Oak and Water, revenue cycle management is strategy implemented to direct administrative and clinical function associated with capturing, monitoring, and collecting a patient service revenue. In the next few slides, I will show you the whole revenue cycle from the time of scheduling an appointment all the way through the time the patient bill is being paid in full. And these processes are very important pieces to the successful of the healthcare organizations. And I will break it down to 3 different stages. The first stages is the front end process. This including the patient access, scheduling, pre-authorization, insurance verifications, point of service, collection, and financial counseling. First, the patient is scheduled for an appointment, and then the front end staff will verify for any update that may be changes from the last visit. And the next step is the insurance verification department need to have a pre-authorization or pre-certification check, and also the medical necessity must be met for the service being rendered. We want to make sure that this service will be covered. Once the front-end staff collect all the information from the patient and confirm coverage and eligibility, the patient cannot be registered in the system. And finally, the financial counselor needs to be ensured that the patient financial aspect, including out-of-pocket and copay and deductible, has been explained to the patients. We will moving on to the middle process. In this middle process of healthcare and revenue cycle management, it's including the chart capture, charge master, case management, clinical documentation improvement or CDI, and coding. The chart capture is a process used by the healthcare provider for documenting, posting, reconciling the charges for the service to render from the patients. And on the other hand, the charge master is an electronic file that has all the billable items, services that are provided to the patient. For example, we will see supplies, device, medication charges for both inpatient and outpatient account. And on this one, each item will be assigned to an internal code such as CPT, HCPCS code, revenue code, charge code description, or sometimes ICD-10-CM. For the CDI role in the revenue cycle, they are responsible to view clinic documentations to ensure that all the services are valid, accurate, and reflect the services that provided before coding. And one is being verified, the coder will assign the diagnosis and procedure that taking from the provided note or laboratory radiology result, any procedure that being performed. And a bill cannot be generated until the coding is complete. And the last important step of the revenue cycle is the back-end process. In this process is involving in claim processing, payment posting, follow-up, collection, and denial management. The revenue cycle management and billing staff work on the claim submission, claim adding to identify any error and correct them before submitting claim to the payers. After the claim is being submitted to the payer payer, they process the claim for payment, and then it will the payment will be received, and then the payment will be posted, and any remaining amount will be billed to the patients. Revenue cycle, in the state of revenue cycle, denial management is very critical because this is all where the profit and revenue for the healthcare facility. And some of the most common causes denial is incorrect medical coding, medical necessity not being met, service not covered by the payers, or missing any authorization or specification for the services. And we know that revenue cycle is like a life cycle. And to keep this workflow in line, we cannot do without the stakeholder. So who are the stakeholders in RCM? The stakeholders play a very important role in the RCM, and these including the patients, clinicians, HIM professional, providers, and payer. The process is start where the patient gets scheduling and being registered in the system, and then the HIM professional need to ensure data collection and capture is correct and not sharing the same patient identifiers. Once the registration admission is done, patient can now see the clinicians. So the clinician role is to provide accurate diagnosis and treatment to the patient illnesses and diseases. And after the document a patient encounter in the medical record, this is assigned to the coding and billing department to translate the diagnosis and procedure into ICD-10-CM, CPT, or HCPCS code. And now claim can be submitted and followed with the third party for any outstanding balances not paid by the payers. On the next slide, I would like to discuss more in depth the importance of a clean claim. A clean claim is submitted claims that are accurate, timely filing, and can be processed without a need for any additional information. It must meet all the following requirements. However, I do want to share a disclaimer for this case because each payer have their own requirement, but the one that I'm showing right now is the basic one that required in the clean claim. The first one is make sure that identifying the health professional or health facility or home healthcare provider or durable medical equipment provider who provides services sufficiently to verify, if necessary, affiliation status and include any identifying numbers. We also need to make sure that the date of service and the place of it is correctly being assigned. Any prioritization is required for certain patient services must contain sufficient to establish the prior authorization being obtained. And all the correct DRG, revenue code, HCPCS code, and ICD-10 must be correctly assigned. And in the revenue cycle, we do not want to see a non-clean claim. The reason being because a non-clean claim is defined as an incomplete claim or a claim that has been suspended in order to get more information from a provider. The payer can reject the claim and it will delay the process of make a payment to the facility. They can deny and reduce, and yes, maybe they can be adjusted later when complete information is obtained, but it will cause a delaying process in payment. And some of the examples for the non-clean claim including the following: missing patient name, MON numbers, date of service, diagnosis code, procedures, or even you have a complete provider note on file, but if he or she forgot to sign, it's still considered an incomplete claim and the payment cannot be processed or billed to the payers. And finally, I like to address the opportunity for HIM in the revenue cycle. So hospital and healthcare practices depend on revenue cycle management for their overall financial health. Therefore, it's very imperative to make sure that we overcome any issue that can hinder the workflow. So what other opportunity we can have for HIM to improve in RCM? We must maintain a workforce proficiency where we can train our staff to collect sufficient patient information. We need to have all prior insurance verifications, validate the EOB, and the process must be scheduled to encounter at least 1 week before the appointment. We also need to have an automatic EOB processing so it can be easily to locate and attract for large amount of EOB. And this can prevent a hidden cost by manual system. We also have to be consistent with the copay collections, streamline the charge capture, and coding process. The claim must be filed promptly. And we also need to have a denial prevention program. So because the system will help monitoring and tracking denial. And last is constantly track the financial health performance regularly to analyze the practice financial. And this concluding my presentation regarding HIM role in revenue cycle management. The next page is the references page. And I would like to thank you for your time. And I hope that this presentation is helpful to you. Thank you.